Hi friends, இந்த வீடியோவில் தமிழ்நாடு ஃபார்மசிஸ்ட் தேர்வு அதாவது MRB தேர்வு 2023 கேட்கப்பட்ட வினாக்கள் மற்றும் விடைகள் தான் இந்த வீடியோவில் நம்ம கேட்டுருக்கோம். இது ரொம்ப யூஸ்ஃபுல்லாக இருக்கும். 2025 ஃபார்மசிஸ்ட் தேர்வுக்கு உங்களுக்கு ரொம்ப யூஸ்ஃபுல்லாக இருக்கும். எப்படிலாம் கொஸ்டின் கேட்டிருக்காங்கன்னு உங்களுக்கு தெரியும். நீங்கள் இந்த வீடியோவை பார்த்து பயனடைச்சுக்கோங்க. வாங்க இப்போ வீடியோக்குள்ளே போகலாம். இந்த கொஸ்டின்ஸ்லாம் 26/4/2023 போன வருஷம் பேட்ச் 1ஓட கொஸ்டின்ஸ் ஃபஸ்ட்டு 50 கொஸ்டின்ஸ் கேட்டிருக்கோம். இதோட செகண்ட் பார்ட்ஸ் இன்னும் நம்ம சேனலில் அடுத்ததாக போடுவோம், பார்த்துக்கோங்க. இதோட பேட்ச் 3ஓட கொஸ்டின்ஸ் நம்ம சேனலில் இருக்குது, பார்க்காதவங்க போய் பார்த்துக்கோங்க. First question, the term Libra means option A pound, option B grain, option C scruple, option D gallon. The correct answer is option A, pound. Next question, the Indian Pharmacopoeia Commission was established in the year option A 2006, option B 2005, option C 2004, option D 2003. The correct answer is option B 2005. Next question, lymphocytes constitute dash percentage of circulating white blood cells. Option A 2 to 10%, option B 1 to 3%, option C 20 to 40%, option D 40 to 60%. Correct answer is option C 20 to 40%. Next question, hematuria is presence of dash in urine. Option A white blood cells, option B platelets, option C red blood cells, option D epithelial cells. Correct answer is option C red blood cells. Next question, name the enzyme which is used in the treatment of leukemias. Option A asparginase, option B proteinases, option C DNA polymerases, option D alkaline phosphatases. Correct answer is option A asparginase. Next question, all amino acids having optical isomers expect. Option A threonine, option B phenylalanine, option C valine, option D glycine. Correct answer is option D glycine. Next question, the biochemical test used to detect ketone bodies in urine is. Option A Benedict test, option B Rothera test, option C Hayes test, option D benzidine test. Correct answer is option B Rothera test. Next question, the lipoprotein that transports cholesterol from peripheral tissue to liver is. Option A high density lipoprotein, option B low density lipoprotein, option C very low density lipoprotein, option D cyclomicron. Correct answer is option A high density lipoprotein. Next question, drug of choice for mass drug administration in case of filariasis is. Option A rifampicin, option B tetracycline, option C diethyl carbamazine citrate, option D mebendazole. Correct answer is diethyl carbamazine citrate. Next question, trismus is the most common symptom of. Option A typhoid, option B diphtheria, option C tetanus, option D gonorrhea. Correct answer is option C tetanus. Next question, which of the following is not a water washed disease? Option A scabies, option B trachoma, option C cholera, option D shigellosis. Correct answer is option C cholera. Next question, BCG vaccination provides protection against. Option A pulmonary tuberculosis, option B CNS and disseminated tuberculosis, option C pulmonary and CNS TB, option D pulmonary and skeletal TB. Correct answer is option B CNS and disseminated tuberculosis. Next question, Vanaspati ghee is fortified with. Option A iodine, option B vitamin A, option C iron, option D calcium. Correct answer is option B vitamin A. Next question, one of the following contains maximum calcium. Option A rice, option B wheat, option C ragi, option D jowar. Correct answer is option C ragi. Next question. A state of rigidity of muscle fibers after death is called option A atrophy, option B rigor mortis, option C hypertrophy, option D tetanus. Correct answer is option B rigor mortis. Next question. Dash are the receiving or input portions of a neuron. Option A dendrite, option B axon, option C nucleus, option D myelin. Correct answer is option A dendrite. Next question. Vomiting center is located in option A medulla, option B pons, option C midbrain, option D cortex. Correct answer is option A medulla. Next question. The most essential element required for the formation of thyroid hormone is option A calcium, option B iron, option C magnesium, option D iodine. Correct answer is option D iodine. Next question. QRS complex in ECG is due to option A ventricular depolarization, option B ventricular repolarization, option C atrial depolarization, option D atrial repolarization. Correct answer is option A ventricular depolarization. Next question. Duration of atrial diastole is option A 0.1 second, option B 0.3 second, option C 0.7 second, option D 0.5 second. Correct answer is option C 0.7 second. Next question. The type of collagen fibers present in the connective tissue of the tendon is option A type 1, option B type 2, option C type 3, option D type 4. Correct answer is option A type 1. Next question. The red pigment hemoglobin is present in option A red blood cell, option B white blood cell, option C platelet, option D cell wall. Correct answer is option A red blood cell. Next question. In which year of the 11th August Drug Inquiry Committee was appointed by the Viceroy of India? Option A 1948, option B 1930, option C 1955, option D 1940. Correct answer is option B 1930. Next question. Among the following, which one is not in the Code of Pharmaceutical Ethics for a qualified registered pharmacist? Option A. Conduct of pharmacy. Option B. Handling of preparation. Option C. Training apprentice. Option D. Disclose the secrecy of the prescription. Correct answer is option D. Disclose the secrecy of the prescription. Next question. Advertisements claiming cure of cancer is an example of dash advertisement. Option A prohibited, option B exempted, option C bona fide, option D permitted. Correct answer is option A prohibited. Next question. The Education Regulation 1991 was laid down by option A central government, option B state government, option C Pharmacy Council of India, option D State Pharmacy Council. Correct answer is option C Pharmacy Council of India. Next question. Mention the form numbers in which import license is granted for drugs specified in Schedule C and C1, excluding those specified in Schedule X. Option A Form 10, Option B Form 10B, Option C Form 14, Option D Form 24. Correct answer is option A Form 10. Schedule N of Drugs and Cosmetic Acts deals with option A list of minimum equipment for efficient running of a pharmacy, option B standard of cosmetics, option C standards of disinfectant fluids, option D standards for surgical dressing. Correct answer is option A list of minimum equipment for efficient running of a pharmacy. Next question. Extractive industries are also called dash industries. Option A exhaustive, option B synthetic, option C generic, option D manufacturing. Correct answer is option A, exhaustive. Next question, poisonous medications should be option A, handled with caution and separated from the other medication. Option B, kept in refrigerator. Option C, kept in room temperature. Option D, should be kept with general medications. Correct answer is option A, handled with caution and separated from other medications. Next question. Trial balance is a dash. Option A, ledger. Option B, statement. Option C, account. Option D, summary. Correct answer is option B, statement. Next question. Working capital ratio is also known as option A, liquidity ratio. Option B, current ratio. Option C, solvency ratio. Option D, efficiency ratio. Correct answer is option B, current ratio. Next question. Unit Trust of India was established in option A 1964, option B 1951, option C 1985, option D 1995. Correct answer is option A 1964. Next question. Dash technique is used to find out how much of the inventory is to be ordered. Option A, VED. Option B, bin card. Option C, EOQ. Option D, IO ratio. Correct answer is option C, EOQ. Next question. The first national health policy was framed and developed in option A 1983, option B 1993, option C 2002, option D 1975. Correct answer is option A 1983. Next question. Drugs stored in cool temperature are stored at option A 8 to 25 degrees Celsius, option B 2 to 8 degrees Celsius, option C 30 to 40 degrees Celsius, option D above 40 degrees Celsius. Correct answer is option A 8 to 25 degrees Celsius. Next question. Individual prescription order belongs to option A outpatient, option B inpatient, option C complete flow stock system, option D unit dose dispensing system. Correct answer is option B inpatient. Next question. Straight catheter is designed for option A bladder, option B intestine, option C kidney, option D liver. Correct answer is option A bladder. Next question. Agents used for reducing acidity in stomach is termed as option A adsorbent, option B protective, option C acidifier, option D antacid. Correct answer is option D antacid. Next question. Bioavailability is defined as option A rate of drug distribution, option B rate of drug absorption, option C rate of drug elimination, option D rate and extent of absorption. Correct answer is option D rate and extent of absorption. Next question. Antihypertensive drug combinations to be avoided except option A amlodipine plus beta blocker, option B diltiazem plus beta blocker, option C methyl dopa plus clonidine, option D diuretic plus beta blocker. Correct answer is option A amlodipine plus beta blocker. Next question. What type of biological characteristics can be predicted in paracetamol adverse drug reaction causing hepatotoxicity? Option A type A augmented reaction, option B type B Bisseri reactions, option C type C chronic reactions, option D type E end of use reactions. Correct answer is option C type C chronic reactions. Next question. The autocoid used for abortion is option A histamine, option B 5-hydroxy triptamine, option C prostaglandin, option D platelet activating factor. Correct answer is option C prostaglandin. Next question. The most effective drug for the treatment of migraine is option A ergotamine, option B promethazine, option C ondansetron, option D risperidone. Correct answer is option A ergotamine. Next question, which of the following is a G protein coupled receptor? Option A, muscarinic cholinergic receptor. Option B, nicotinic cholinergic receptor. Option C, glucocorticoid receptor. Option D, insulin receptor. Correct answer is option A, muscarinic cholinergic receptor. Next question, which of the following drugs is commonly administered by intranasal route? Option A, adrenaline. Option B, desmopressin. Option C, ganirelix. Option D, insulin. Correct answer is option B, desmopressin. Next question, aspirin prolongs bleeding time by inhibiting the synthesis of option A, cyclic adenosine monophosphate in platelets. Option B, clotting factor in liver. Option C, protocyclin in vascular smooth muscle. Option D, thromboxane A in platelets. Correct answer is option D, thromboxane A in platelets. Next question, which of the following drug is a angiotensin receptor blocker? Option A, labetalol. Option B, lisinopril. Option C, losartan. Option D, prazosin. Correct answer is option C, losartan. Next question, the common side effect of thyroid hormone is option A, increase in basal metabolic rate. Option B, angina pectoris. Option C, nausea. Option D, exophthalmos. Correct answer is option D, exophthalmos. Last question, choose an emetic drug of central action. Option A, ipecac derivatives. Option B, promethazine. Option C, dropisterone. Option D, amorphine hydrochloride. Correct answer is option D, amorphine hydrochloride. ஓகே ஃப்ரெண்ட்ஸ், பேட்ச் 1ஓட ஃபஸ்ட்டு 50 கொஸ்டின் பார்த்துட்டோம். அடுத்த 50 கொஸ்டின் அடுத்த வீடியோவில் பார்க்கலாம். அடுத்த வீடியோ வேணும்னா நீங்கள் நம்ம சேனலை சப்ஸ்கிரைப் பண்ணி வச்சுக்கோங்க. ஓகே ஃப்ரெண்ட்ஸ், இது போல் இன்ட்ரெஸ்டிங்கான வீடியோஸை பார்க்க நம்ம சேனலை சப்ஸ்கிரைப் பண்ணிக்கோங்க. கூட இருக்க பெல் ஐக்கானையும் ப்ரெஸ் பண்ணிக்கோங்க. அப்போ தான் நான் போடுற ஒவ்வொரு வீடியோவும் உடனுக்குடன் உங்களுக்கு வந்து சேரும்.